$560 to $635 billion a year. This is the cost of chronic pain has on society according to the American Academy of Pain Medicine. That's like $2,000 per person for everyone in the United States. I'm Cliff Warren, and I personally know people that suffer from chronic pain. Both my parents suffer from neuropathic pain and arthritis and other things that are not properly treated by just their opioid medications. Haley did a great job of discussing the benefits of marijuana in both cancer patients and epileptics. I'm going to try to add to that theme by discussing adversities faced by chronic pain patients and how marijuana may be able to help them manage their symptoms. Current treatments in place for the management of chronic pain are substantially lacking in both safety and efficacy, and there's a need for there to be more options for those that are suffering. Marijuana may be able to do that, but for that to be an option, there needs to be a lot more research on the use of cannabis for those people. I'd also, like Haley, like to urge you to vote yes for any future propositions to make the use of marijuana federally legal for prescription use by those patients who suffer from chronic pain, and for the pain management providers to safely and more effectively give them some options for long-term care. I'm sure everyone in the audience has had some type of interaction with someone that suffers from chronic pain. Maybe that person's you even. Did you know that chronic pain affects 1.5 billion people worldwide? 100 million of those people alone are in the United States, according to a 2006 survey that was conducted by the American Pain Foundation. They surveyed the patients, and the patients said that their pain management is not adequately controlled by their opioid treatments. Current opioid medications approved for use for chronic pain by the FDA have many risks associated with their long-term use. Listed issues observed in some of the studies has been everything from addiction to the medicines themselves, sleep time breathing issues such as apnea and stopping breathing and having issues while you're sleeping, fractures, different dysregulated issues that occur within the hypothalamic, pituitary, and even your adrenal systems themselves. Due to the risks involved, the patients and prescribers often are subject to excessive and unfair scrutiny by their peers and the drug enforcement agencies that investigate overuse of those same products. The addiction issue with opioids poses a drug diversion issue, which can make it increasingly difficult for those people that are truly suffering from those pains to get their meds in a timely manner, sometimes even at all. High-dose opioids rarely maintain effectiveness over the long term. An article that was done and written titled "Smoked Cannabis for Neuropathic Pain," co-authored by multiple doctors to include Ware, Wang, Shapiro, and several others, discusses the details of refractory relief by those opioids where it wasn't working at all. Narcotics are addictive, everyone knows that. The majority of the approved current medication and therapies for the treatment of the chronic pain are narcotics according to the FDA. Some of these include Loratab, oxycodone, hydrocodone, fentanyl, morphine, Percocet, and those are just a few of the pain meds that are regularly prescribed to patients. According to the Center for Disease Control and Prevention, 44 people die every day in the United States from prescription drug overdoses. Many physicians want the ability to utilize marijuana in the treatment of their patients' conditions. A 2014 survey in Hawaii showed the efficacy of cannabis without negative side effects. Those patients that were studied, they noticed relief of their anxiety issues. Insomnia was, corrected. They got some relief from insomnia. And at the end of that study, those physicians who conducted the research ended it with a plea to the U.S. government to release cannabis from the Schedule I status by the feds to allow for those further studies. According to another article published in Science Direct by Dr. Wilsley, titled A Journal of Pain, clearly suggests vaporized cannabis in low doses can alleviate symptoms of treatment-resistant neuropathic pain from just opioid use itself. The dose was recorded as being low enough that the person could function normally throughout their daily routines. Science Direct also published a co-authored study which showed inhaled cannabis extract 3 times a day was effective against opioid-resistant neuropathic pain. Those same physicians that conducted that second or third study also ended it with a plea for studies regarding long-term safety and efficacy for the use of cannabis. We discussed the lack of efficacy for the current treatments for cancer, epilepsy, and chronic pain, as well as giving some insight in several publications from medical professionals who see the suffering of their patients every day with no end in sight for them. The need is great for researchers to be given the green light to go forward with research in the development of treatments possibly utilizing cannabis and to test long-term safety and efficacy for those patients. Think back to Jaden and Charlotte. If their parents had given up after exhausting all the current FDA-approved treatments for their Dravet syndrome, it's possible they could be dead today. But instead, they're thriving and they're happy as a result of their parents' determination to look at alternative treatments for their problems. Please, the next time that you see a proposition to further the advancement of research and acceptance for medical marijuana, vote yes. You never know. The next person who needs it in this room could be you. Thank you.